Kenya has made recommendable strides towards improving utilization of contraceptive services. The number of women using contraceptives has risen considerably over the past 6 years, from 46% in 2008 to 58% in 2014. At the 2012 London Summit on Family Planning, Kenya made a strong commitment to ensure more women have access to contraceptives. However, like many sub-Saharan African countries, reproductive health services like family planning, HTC, cervical cancer screening, and other sexual and reproductive health services are being availed to clients as parallel services. There have been minimal efforts to integrate these services as a health package, presenting missed opportunities and inefficiencies. In ensuring clients access and utilize multiple services simultaneously, KMET formed the Huduma Poa Health Network. The network is currently made up of 80 privately owned health facilities serving urban and rural underserved population, with 63% presence in the rural areas and 37% urban. Huduma Poa operates in 15 counties drawn from Nyanza, Western and adjacent Rift Valley region. The network aims at harnessing skills and energies of private health providers to integrate health services and ensure facilities are a one-stop shop for the target underserved communities. To realize this, the network builds capacity of healthcare providers through workshops, quality assurance assessments, support supervision and on-job training based on the Ministry of Health standard operating procedures. The trainings focus on family planning method mix, HIV counseling, testing, care and treatment, prevention of mother-to-child transmission of HIV/AIDS, cervical cancer screening, and integrated management of childhood illnesses. Huduma Poa Network has a team of quality assurance officers who offer technical support to network providers aimed at enhancing quality service provision in the health areas supported by Huduma Poa.
My duties as a quality assurance officer is to work in partnership with the Ministry of Health to help in assessment of private facilities to join the Huduma Poa network. One thing we need to do is to assess the capacity of these facilities in terms of service provision. We also look at the qualification of the providers before they actually join the network. Once we've recruited the facilities into the network, we also assess the capacity need. Then we recommend for training in our 4 areas of intervention. We also do mentorship and OJT to other staffs who did not have opportunity to attend the training.
In order to promote health-seeking behavior among communities, Huduma Poa has an established demand creation component comprising of 176 community health volunteers and 5 demand creation officers mandated to forge linkages between the facilities and target communities.
I'm Beatrice Akinyi. I work as a demand creation officer. My main work is to increase demand and access to health and information services through reproductive health information. This one we do in conjunction with the community health workers who are recruited with the help of the community health extension workers and with the knowledge of the community focal person in the community. The community health workers are trained on family planning, cancer screening, HIV testing and counseling, and integrated management of childhood illnesses. The community are equipped with counseling bags and IEC materials. We go to chiefs barazas to give information. We give health education in women groups and in churches. At times we go for house-to-house counseling and visitation. The community health workers meet the husbands and the mothers and the fathers-in-law of the community to give information, because we find that in most communities there are myths and misconceptions that is barring the community from getting the services or also going for the services of family planning.
Health education sessions offer opportunities for clients to cite and share their concerns, worries and experiences in family planning, including myths and misconceptions. The use of public address system in mobilizing rural communities has effectively complemented other forms of demand creation, including use of posters, door-to-door visitations, mobilization through chief barazas, church gatherings, and marketplaces.
uzazi hapa, mmekaribishwa. Karibu, kujeni wote.
Community health volunteers refer community members to the health facilities to access integrated services. This has resulted in more clients receiving services and improved utilizations of long-acting and reversible contraceptives. Besides serving clients who walk into the facilities for services or those who are referred by the community health volunteers, the franchise facilities, in collaboration with the Ministry of Health, organizes outreaches within their catchment areas to avail services to distant, underserved communities.
Now in the Lake region, where we have the fisher folk, the mobilization basically is done at the beaches. Some of these people are fishermen who have brought their fish on shore. We also have women whose work is to be able to clean the fish and sell it. So at this point, this is where the community health volunteers will mobilize these people. So our outreaches are basically carried out at the beach or the fish banders that are all over these beaches. Usually the Ministry of Health supports our activities in terms of identifying the areas where we carry out these services.
Huduma Poa has harnessed the power of partnership to deliver healthcare to target population in various counties. The franchise collaborates with counties in the First Lady's Beyond Zero campaign, using the Beyond Zero mobile funds to conduct mega outreaches focusing on integrated family planning services, HTC, cervical cancer screening, and child health services.
This outreach is really very key. We want to appreciate KMET for having come over to Kisii in one of our rural areas to really assist the community in many other integrated activities that have gone on well today, especially family planning, where we have seen overwhelming clients coming in to uptake methods and the long-acting methods, which are very key. We want to believe with the population in Kisii, we want to affirm family planning methods, especially the long-acting method, with the clients uptaking it even from the time they are pregnant. They are able to be really given the information about the family planning methods we have, and they are able to choose even a method so that after delivery they are able to uptake it up very well.
Nimefurahia kwamba hii mipango ya Kisii County Government na hii washikadau wengine kama KMET imekuwa mzuri sana na imefana katika hii ward yangu. Changamoto ambayo tuko nayo, nimeona watu wetu ni wagonjwa sana na inaonekana facilities yenye wanatumia siko mbali na wao. Kwa hii ushirikiano wetu na hawa washikadau, naona nawasaidia kuleta huduma karibu na wao.
Wananchi tumehudumiwa vizuri, afisa wetu wamehudumiwa vizuri, tumepata madawa, ijapokuwa watu wengine wamerudi bila kuhudumiwa. Tunaomba tena mrudi, mtualike siku nyingine ili wananchi wapate huduma sawa na wafurahie katika huduma yao.
This has been a very wonderful exercise. Quite overwhelming to see this number of clients really come to access integrated reproductive health services. The greatest lesson that I've been able to learn today is the power of partnership. The way in which we have been able to collaborate with the county teams within this area, the sub-county health management teams. Remember, the South Kenya Conference was here, the Kenya AIDS Response Program, to try and increase access and demand for the services that we support as a social franchise. And for us in Huduma Poa, this has been a journey and a dream that has come to happen.
The network has strived to forge and sustain linkages between the private providers and the Ministry of Health. This has shown remarkable improvements in submission of monthly service delivery reports to the Ministry of Health, commodity forecasting and quantification, ordering and acquisition of reproductive and child health commodities by member clinics from the Ministry of Health stores. Huduma Poa brings on board the county and sub-county health management teams for periodic supportive supervision to the franchise facilities to monitor and improve the standards of quality offered at the clinics. The network conducts performance review meetings with franchise providers, community health volunteers, county and sub-county health management teams. The review meetings enable the network to reflect on performance and establish more effective way to accelerate demand and access for integrated services.
That is leaving only 35% for either depot, rails.
Huduma Poa's success has been made possible by another seamless working partnership with Population Services Kenya. PS Kenya worked KMET in the initial stages of setting up the network, establishing contracts with the selected clinics, communicating with the clinics and building capacity at the clinics to improve service quality. Within a period of 2.5 years, Huduma Poa has realized significant increase in the uptake of long-acting and reversible contraceptives. Utilization of long-acting and reversible contraceptives has risen from 1.5% in 2012 to 42.43% in 2015. Whereas utilization of injectable contraceptives has remarkably declined from 71.5% in 2012 to 43.5% in 2015. Up to 164,971 women of reproductive age have accessed integrated reproductive health services through Huduma Poa clinics, Huduma Poa days and outreaches. 63,622 women have accessed family planning services, whereas 81,169 clients have been reached with HIV testing and counseling services. Majority of the network providers have confirmed that since they joined the network, their workload and patient flow has increased with consequent improved profitability.
The partnering with the KMET and the mobilization that we started, it has actually made the numbers go up. Okay. It's an improvement.
Before our facility was incorporated with the Huduma Poa, actually I didn't know how to insert an IUCD. I didn't know how to do cancer screening. I had not been trained on IMCI. So after the training, I was so passionate. I remember my mentor is Mildred. I used to disturb her so much.
For a long time, our area has really been the family planning uptake, especially long-term family planning method has really been very low. So since inception and engagement with KMET, we have really seen a tremendous improvement in our family planning uptake. Currently, we are at 79%, and we've come really a long way from as low as 55%.
Reducing unplanned births and family size will save on public sector spending for health, water, sanitation and social services and reduce pressure on scarce natural resources, making social and economic development goals easier to achieve.